Hello and welcome to my presentation on the psychological factors in older patients at risk of falling. The definition of a fall is defined as by the World Health Organization as an event which results in a person coming to rest inadvertently on the ground or floor or any other low level. The WHO statistics show that falling is the second leading cause of accidental death in the world, and that the people over the age of 65 experience the most fatalities from falls. But falls can also cause severe injuries such as pelvic fractures, which for the elderly person can be life debilitating. There are two major influences that can cause falls. These come down to the environment and the individual. These are broken down further on the slide. For this presentation, the focus will be on Medway in Kent, which is based in the southeast of England. Medway is made up of Chatham, Gillingham, Rochester, Rainham and Stroud. The Medway population consists of 263,925 people as of 2011, of which 40,600 are aged over 65. It is expected that by the year 2037 that the average population in Medway of this age group will increase to 69,800. This goes to show that with many improvements happening across lifestyle and healthcare, that there is an ever-aging population. An ambulance service that operates in the Medway area released statistics on the amount of falls calls they receive. The service as a whole receives 63,000 calls related to falls. This makes up 20% of emergency calls. Medway alone had 2,746 calls that were related to falls. The graphs here show how a rise in calls and admission to hospital has a dramatic increase at the age of 85 because of falls. Falls can lead to psychological issues for the elderly, which normally starts due to having a fear of falling. Statistics show that 70% of people who have experienced a fall have a further fear of it happening again, and 40% who have not experienced a fall still admit to having a fear of falling. A fear of falling is defined as by Parry, Finch and Deary as adverse psychosocial difficulties related to falling, including fear, anxiety, loss of confidence and impaired perception of their ability to walk. So what can this cause? As previously mentioned, the fear of falling can lead to anxiety, loss of independence, social isolation and reduced mobility. Because of this fear of falling, it leads to the elderly wanting to reduce their movement, therefore isolating themselves to a bed or a chair. This isolation leads to deterioration of muscles, making them more unsteady on their feet and prone to further falls. They will also start to drink less due to not wanting to go to the toilet, which can also lead to health complications. They would also become more socially isolated as they won't be leaving the house as much, which can further lead to depression and anxiety. An example of this would be an 88-year-old female who had been in her bed for 3 days due to a previous fall. She had carers twice a day who would assist her with using facilities and for breakfast and dinner. This patient had proceeded to try and use the toilet on her own and in the process had fallen while attempting to get out of her bed. She was found a few hours later by the carers who had phoned for an ambulance. The ambulance crew were told by the carers that she doesn't like to move due to her fear of falling over again and injuring herself. The crew decided to make a referral to her GP to visit her for a medication review, as well as a referral to the falls team due to a lack of aids and support around the house. A lot of falls, however, can lead to an injury as well, whether a fracture or a head injury that results in the need for the patient to be taken to hospital. There are various care pathways in place, whether clinical or non-clinical, that appear on this slide. The falls referral team are a multidisciplinary team that are made up of occupational therapists, physiotherapists, rehabilitation assistants, who are able to assess the patient and their environment as to what they can do to prevent it happening again. This can include walking aids and exercises to help with muscle strength and balance. Warding accommodation is where elderly people can live that allows for them to keep independence, but also has carers on call if needed. Furthermore, social interaction can take place amongst other residents, helping reduce depression and anxiety in the long run. So what is being done to help? The National Institute of Health and Care Excellence have provided guidelines that aim to reduce the incidence of falls. It looks at the prevention of falls in the community and at hospital, as well as providing a risk assessment for elderly people who are recurring falls or presented with a medical condition that caused their fall. Also, Medway itself has put in place a plan that is to raise more awareness of the elderly faller. It consists of various actions such as providing falls training in care homes and a rapid access full service for the ambulance service to improve patient wellbeing. Finally, the Department of Health released a document to look at the prevention of falls, which has 4 main objectives: to improve patient outcomes and efficiency of care post-hip fractures, respond to a first fracture and prevent the second, early intervention to restore independence and to encourage physical activity, and healthy lifestyle to prevent frailty and reduce accidents. Thank you for listening.